Hello and welcome to this special edition of The Heat. I'm Anand Naidu, coming to you from my home just outside Washington, D.C. With COVID-19 changing the way we broadcast, this is our new reality. April will be remembered as the worst month for American workers since the Great Depression. The U.S. unemployment rate hit 14.7% in April, the highest rate since the 1930s. More than 20 million jobs were lost last month as the result of the coronavirus pandemic. Joining us now to discuss the U.S. economy is John Quelch. He's Dean of the Miami Herbert Business School at the University of Miami. Dean Quelch, thanks so much for joining us.
Thank you, Anand.
We look at the unemployment figures in the United States. Over 20 million people lost their jobs in April. We look at the jobless claims, 33 million people. Do you expect those numbers to go higher, or as some businesses in some parts of the country start to reopen, will we see a reversal of that, numbers starting to go down?
Well, of course, the 14% or 14.7% unemployment rate represented by these numbers perhaps understates the true level by maybe 5 percentage points. I remember maybe 6 weeks ago, the dire forecasts were over 20 million, and now we're at 33 million. And so this has to be extremely nerve-wracking for our policymakers in Washington. I think in actuality, the number could go even higher because there's a certain number of people who simply have not been able to yet file their claims. And in some states, that's proving to be harder than in others. So I would not expect the number to diminish in May. If we're lucky, by August, we will see the number going down.
Right. There's an analyst at the credit ratings agency Moody's who says that he expects there to be a strong rebound in the third quarter. You agree with that?
Yes, the second quarter has been so devastating, and the pressure on the economy to reopen is so great that I think we will see a strong rebound in the third quarter, but it may be at the price of a second wave of the coronavirus during the fall. As the temperatures go down and the winter season starts up again.
John, we've seen these stimulus bills from the United States government, from the US Congress. What more needs to be done?
Well, there's definitely going to be a need for further stimulus. And, the Fed has not necessarily used all of the weapons in its arsenal yet. So I would expect to see a fourth round of stimulus. One of the things that slightly amazes me is why infrastructure, which is really an obvious need in this country that could put a large number of people back to work, why infrastructure is not more on the table. Certainly in China, the government has taken a very strong stand to invest heavily in infrastructure, not just roads and bridges and airports, but IT infrastructure as part of its recovery program. And we still seem unable to get that act together.
There's an economist at RBC Capital Markets who says that these loans that the government is making to small businesses, these forgivable loans, that could play a big role in reducing the number of unemployment in the weeks ahead.
Well, it certainly could make a dent. There's no doubt about it. Some people would argue that many of these businesses that are being saved are businesses that might not have, in the normal course of events, survived. But we can't, at this point in this emergency, discriminate between businesses that would have made it anyway and businesses that wouldn't have made it. Obviously, a lot of these small businesses are retail businesses that do employ significant numbers of relatively low-paid people, and getting them back into the workforce would be obviously extremely helpful. So there's no doubt that the small business sector is a major employer, and we need to revitalize that sector.
There is one other problem, of course, in that this program to help small businesses, it's been really bedeviled by log jams, by bottlenecks. There are people who have applied for loans and they get less than what they asked for. Others have not heard back at all. Why is the system working so inefficiently?
Well, I think the system is working inefficiently because there is no system that had been put in place for obvious reasons to deal with this scale of crisis. And, you know, you see that playing out in the hospital sector when we look at hospital wards on television. And the same thing is playing out in this arena as well. And I think it's a little bit unfair to be overly critical of the government, because who could have ever forecast this? And ramping up a team, a nationwide team, to process successfully and legitimately the number of loan applications that are coming in. You know, that's really a tough thing to ask in the space of 6 weeks or so. So, you know, I think that the money is flowing through. I'm sure that everybody in Washington wants it to work as quickly as possible to get us out of the box that we're in. But clearly, as with any new program implemented by a bureaucracy, there's going to be snafus, delays, and a lot of disappointment.
How great are the risks of reopening the economy? Reopening too fast could result in a big rise in infections. We could get back to the situation where we were 2 months ago.
I think that is a risk, and I think that obviously there is a lot of discussion behind the scenes about the trade-off between the economic risk of remaining shut versus the health risk of opening and then potentially having to reshut or backtrack. And this is a very, very difficult balance to draw. But frankly, the pressures on the economy are so substantial at this point that I really see the risk of reopening being accepted by many policymakers because they just don't want the economic catastrophe that could come from being in a closed economy condition for another 2 months.
And some of those pressures, John, coming are political pressures, aren't they?
Absolutely, absolutely. I mean, you know, the fundamental trade-off is obviously that horrible trade-off between, on the one hand, the economic health of the nation and the number of families that are being put with their backs to the wall as a result of this situation, the mental health fallout from that, all of that on one side of the ledger versus the prospect of potentially tens of thousands of additional deaths if there is premature opening and the second wave takes hold.
I want to look at some specific industries. The airline industry, for instance. The CEO of Delta has sent a letter out to his workers telling them that recovery could take 2 to 3 years. We're also hearing from some travel industry analysts that we could see higher fares, fewer routes, and extras like food on the plane, etc. That could be something in the past.
Yeah. So on these specific issues, I think the airline industry is never going to be the same again. First of all, there is going to be a certain amount of business travel and conference-related travel that's simply not going to come back because people are going to be more efficiently and productively working with each other remotely rather than visiting face-to-face. You then look at discretionary travel. Typically coming out of a recession, folks like to stay closer to home when they go on vacation. They're nervous about taking an adventurous trip halfway around the world. So discretionary long-haul international travel, I would expect to see that coming back later vis-a-vis short-haul domestic discretionary travel. Food and beverage service on an airline, if everybody is wearing a mask for the months ahead, what's the good of that if they're taking the mask off to drink and eat? So that may be gone. So I think on all of these fronts, the airline industry just not going to be the same again, Anand.
And looking at the retail industry, we've just heard that one of the big department stores in the United States, well-known company, Neiman Marcus, has filed for bankruptcy. So it was already in trouble, but this pandemic has been a mortal blow to it. A lot of the retailers were already under pressure before the pandemic because of online stores. But do you think this pandemic will accelerate their demise?
No doubt accelerating the demise, no doubt accelerating bankruptcies. Obviously, people are discovering that they can buy more conveniently and with absolute assurance of good quality through Amazon and other online outlets. At the same time, though, I think that there is a ongoing need, no matter when the reopening occurs, for consumers to feel like they are part of local communities. They will want to go out and about and enjoy social experiences in local communities. That may be very helpful in revitalizing small town high streets, for example, but at the same time, a good department store that's serving a suburban community, I still think that there's going to be a market for that. I still think that there's going to be a market for the shopping mall that has that anchor department store. People will want to go out and about and kick the tires and smell the merchandise, feel the merchandise like before. Yes, there'll be a shift that will be a permanent acceleration towards online, but I would not count the retail sector out.
Let's hope you're right, John. Thanks so much for joining us.
My pleasure, Anand. Thank you.
That was John Quelch from the University of Miami. More of our conversation on the global impact of coronavirus right after that. We'll be looking at the country of Iran. Stay with us, you're on The Heat.
In a world that's constantly moving, what is it that really defines us? Is it the ideas of our time or the trends that shape our lives? Full Frame, weekly on CGTN America.
Welcome back to The Heat. I'm Anand Naidu, broadcasting from my home just outside Washington, D.C. Iran is one of the worst hit countries in the Middle East, with more than 100,000 cases of coronavirus infections. In April, President Hassan Rouhani started the process of reopening the country, and recently mosques were allowed to reopen. Joining us now via Zoom from Tehran is Bobby Naderi. He is an Iranian journalist and political commentator. Also with us, Barbara Slavin is the director of the Future of Iran Initiative and non-resident senior fellow with the Atlantic Council in Washington, D.C. Thanks to both of you for joining us. Bobby Naderi, let me start with you. There are now 100,000 cases of coronavirus in Iran, 6,000 deaths. The health ministry says there is a downward trend in both the number of deaths and the number of infections. What is your assessment of the situation in the country?
Well, I'm afraid these are not accurate figures for the time being. As a person who has been on the front line of the fight against this deadly disease, I saw how difficult it was for the authorities to have even, a couple of test kits to start, the business of trying to find out what is really going on in this country. We had serious shortages with regard to face masks, personal protective equipment, and so on. So what you hear from the authorities right now is what they have to offer us right now. We don't have access to each and every person in this country. The government is unable to test millions of people on a daily basis. So these figures that the government is talking about are just optimistic. If you are asking me, more people have been killed, more people have been infected, and I'm afraid it's still an upward trend in some parts of this country right now.
So, Bobby, these numbers are being distorted because of a lack of testing. The government lifted some restrictions this week. They lifted restrictions on people going to mosques, but they call on worshippers to maintain social distancing guidelines. What kind of response has there been to that? Are people going to mosques?
That is sad. I don't think people are going to mosques. I did a report yesterday. I didn't see anybody in any mosque in the capital, Tehran. People are not trying to take any risks at the moment. If you see some people getting back to business, opening up their shops, is because they are desperate. I mean, they cannot afford to stay at home. The government doesn't offer any cash handouts to people what we have seen in the United States or in Europe. So people have been left to their own devices, and they have no choice to get back to work one way or another. And that's precisely what everybody is trying to do right now. I mean, prices are going through the roof. People are unable to make ends meet because of sanctions and restrictions. We have no access to US dollars or medical supplies or whatever you name it. We don't have those luxuries that other countries are enjoying right now. So if you're asking me, this is a desperate situation in a desperate nation, and they have everything. They have every reason to get back to work and risk their lives because they have no other choice.
Barbara Slavin, Iran has a population of 82 million. The figures we're seeing right now are relatively low, but as we just heard from Bobby, it might not be a true reflection of what the real situation is like because of a lack of testing. But the other point about Iran is that it's also facing crushing sanctions. And I'm wondering, to what extent has the situation in Iran been made worse by sanctions?
Well, I think it's pretty clear that sanctions have played a role in weakening the Iranian economy over the last several years. As you may recall, after the Joint Comprehensive Plan of Action, after the Iran nuclear deal was implemented, Iran started to experience economic growth again after a period of some time when the economy had gone in the other direction. Now, because of sanctions, we've seen that growth end and Iran go into a deep recession, and this was before COVID-19. So clearly sanctions have played a role, and they've also made it more difficult for Iran to get medicine and medical devices, even though these items are ostensibly not sanctioned. Foreign companies are simply not doing business with Iran because they're afraid of falling afoul of the sanctions on Iranian banks. So I'm very sorry to hear that the situation is as desperate as Mr. Naderi described it. I think it's a great tragedy, and the world should be helping Iran now, not sanctioning it.
And Barbara, the United States Secretary of State, Mike Pompeo, he said that medical supplies are exempted from these sanctions, but Iran has still found difficulty sourcing these supplies. The other point is that they can't pay for them because of financial sanctions.
Yeah, exactly. I think it's a really hypocritical statement. The Treasury Department has put out some new guidelines and so on. We've even created a so-called Swiss channel for Switzerland, which is a big supplier of pharmaceuticals. But apparently no transactions have gone through this channel because the reporting requirements are so onerous that no company can possibly meet them. The Trump administration's policy of maximum pressure has been incredibly cruel and incredibly counterproductive. It has not achieved the stated goals of the administration, and it certainly is contributing to a very, very dire humanitarian situation in Iran.
Bobby Naderi, the Iranian foreign minister, has issued an appeal for things like masks, for ventilators, for medicines. What kind of response has there been to that appeal?
Well, that's a good question. As I told you, I've been following this situation from the early days of the pandemic in the Iranian capital and elsewhere in the country. China was the first nation to send us test kits. And that's precisely why we were able to detect our first cases in the capital, Tehran, and beyond. After that, it was the European Union, in which the United Kingdom, France, and Germany sent medical aid to Iran. Just one plane, by the way. I was there at the airport, in the international airport outside the capital, Tehran. They only sent the plane load of medicine to us, and that was it, really. And I'm challenging you, after this program, try to send just $20 to Iran as a humanitarian gesture. Say that I want to send this to the people of Iran, not the government, the people, and I want them to buy medicine or test kits or whatever that is going to help them fight this deadly disease. You won't be able to do that. Why, Anand? Because we are dealing with private companies, not just the governments, and these private companies are not willing to take any risks because they know that they are going to be financially attacked and brought under accountability by the U.S. Treasury Department. That's precisely why we are extremely unable to have our hands on any test kits or any medical supply. Mike Pompeo is a hypocrite. I think he's lying to his teeth, and he's trying to turn the attention or international condemnation from the Trump administration for the fact that even medical supplies are being sanctioned by the United States. Why? Because nobody is willing to take risks because they want to avoid financial penalties. That's why the situation has gotten worse. Don't listen to what the government says here. Don't believe each and every figure that the government, announces each and every day. It is bigger than that. We are unable, simply put, to test each and every person in this country. They called me, they called my family, and they said if we were doing good. I said, yes, we have been under quarantine for 2 months, and that was it. And that was our test kits. They didn't ask us to go to any medical center or hospital to take these tests. They just called us and that was it. They considered us as free from the disease. But that is not the case because we know that kids are carrying these diseases, the symptoms of the disease, and they are not being affected, but they are going to affect the elderly. So the figures that you are here, you are listening from the capital Tehran is only for, domestic consumption. In reality, many people have lost their lives and many have been affected.
Barbara, as if Iran didn't have enough challenges trying to deal with this pandemic, the United States is now circulating a draft resolution at the United Nations to extend that arms embargo against Iran. You mentioned a moment ago that this is a policy of maximum pressure against Iran. I'm wondering, what is the end goal of this U.S. maximum pressure against Iran?
I think it's collapse of the regime or capitulation. And although the situation is obviously very, very serious in Iran, I don't think the government is going to collapse. I think people are, and Mr. Naderi can comment, but people are relying on the government to provide whatever help it can. And they're certainly not in a mood to go out and make a new revolution in the midst of all these calamities. So the other thing is capitulation, and the Iranian government has made it very clear it's not coming back into negotiations with the United States, which was the first to violate the agreement by leaving it unilaterally when the United States was in compliance. You mentioned this business at the UN about the arms embargo. I find it very hard to understand how this is going to succeed. The United States left the deal, so how can it now claim it has the right to snap back sanctions? That seems like really circular logic to me.
Well, the United States
and why would Russia or China abide by such a resolution? It makes no sense.
The United States seems to have this very novel interpretation of what it's doing here by saying, look, we were original signatories to that agreement, so that still gives us a say.
Yeah, Frank Wisner is a former ambassador, a very distinguished gentleman. I was on a program with him recently. He called this the height of sophistry. You can't say you're out and then say you're in. And again, who is going to abide by this? Russia and China. This is assuming Iran has money to buy expensive new weapons, which I rather doubt. Also, to the extent, the behavior that really bothers us has not been affected by this arms embargo. Iran has provided rockets to the Houthis and precision missiles to Hezbollah, despite the arms embargo. So even if it were, quote unquote, extended by some sort of UN resolution, I don't think it would have much impact on the ground.
Bobby, how is this policy of maximum pressure being seen in Iran?
Well, it is, as I told you, it's a desperate situation. We are now seeing people talking about how the nuclear program or Iran's, capabilities in building its own weaponry because of UN sanctions is not going to feed the nation. People want food. People want jobs. They don't want nuclear weapons or nuclear program or whatever you call it, a state-of-the-art weaponry. We don't want those things. And that's precisely what we want right now. We want public health. We want security for our jobs, and at the same time, we want safety for our families. Make no mistake, Iran can defend itself, but to some extent, that is not going to continue forever. The maximum pressure campaign has had huge impact on us, on each and every family in this country, because Trump is lying to his teeth when he says that we are only targeting the government. That is not the case, I'm afraid. I mean, as a person, as a parent, if I want to send my kid to England or the United States, how on earth am I able to send him or her money? How can I do that? I mean, it is affecting everybody. People, because of the travel ban, I have seen families here for years and years, they haven't been able to see their beloved ones in the United States. And those people over there have no guts to come here, because if they know that if they get back to Iran, they won't be able to get back to the United States. Then how on earth do these people try to, fool us into believing that their sanctions are not affecting people, ordinary Iranians? That's
Bobby,
not the case at all.
On the pandemic itself, the government in Tehran has adopted a color coding system, yellow, white, red, to determine which are the heaviest concentrations of infections. Which are the hotspots in the country?
Well, hotspots are the northern parts at the moment, and of course the southern parts. I mean, I'm talking about the oil-rich regions of the country and the tourist sites. People, and listen, you have the problem of panic buying in the West. No doubt about it. We have the problem of panic working and panic traveling here.
Yeah.
People want to work because they are hungry. They have to make ends meet. And at the same time, we have some filthy rich people that they don't care about the social distancing measures. They want to travel, especially to the northern parts. And that is spreading the disease across these tourism sites. And of course, we have the problem in the southern parts of the country, the oil-rich regions, that government has been unable to provide test kits and medical, supplies and so on. So different things, different factors are affecting different populations in this country through different means. And that's precisely what is happening here. The government says that we are going to respect the social distancing measures, but that's just an aspiration. People don't care. They don't care at all. As long as my family is hungry, as long as I'm out of job, I'm going to go out and do whatever I can to make some money for my kids. That's precisely what people are exactly right now doing. As I told you, you have the problem of panic buying. We have the problem of panic working.
Barbara, at a time of this crisis in Iran, well, it's a crisis throughout the world, actually, and with the United States trying to turn the screws on Iran, I mean, not everybody agrees with this policy as far as US allies are concerned. We hear the European Union expressing its regret that the United States actually blocked International Monetary Fund help to Iran. And I'm wondering how deep these divisions are, and is there a likelihood that the Europeans might actually go on their own, might act unilaterally?
There are very deep divisions, and this is something that we at the Atlantic Council really are concerned about, because US policies in general do not succeed unless they are multilateral, and especially unless the United States is working closely with its most important democratic allies, namely our allies in Europe. I think the Europeans have tried. They have created this vehicle called Instex, which did manage to send some German medical equipment to Iran earlier this year. I don't know to what extent they're still working on this and trying to use it further. I hope they are. I know that they've made efforts in the past to try to get some sort of sanctions relief. And, it may not be possible, frankly, with the Trump administration, but we have an election coming up, a very important one in November. And if Trump is defeated and if the Democrats return, I think there will be the possibility of working again with Europeans and also rejoining the Iran nuclear deal and providing sanctions relief to Iran.
Okay, and that's where we have to leave it. Barbara Slevin, Bobby Naderi, thanks to both of you for joining us.
Thank you.
Thank you.
And that's where we have to leave it. That's all we have time for, but the conversation continues online. You can join us on Twitter at CGTN America or on Facebook at facebook.com/CGTN America. I'm Anand Naidu. Thanks for being with us.